Hello everyone, welcome back to my YouTube channel that is Nursing Tricks. I hope you all are doing well, and if you have not subscribed my channel, please do subscribe. Continuation to the previous video in which we have seen the pneumonia, or you can say just we had the introduction to the pneumonia, in which we have seen the definition of the pneumonia, classification of the pneumonia. We have seen the various risk factors, we have seen the clinical features of the pneumonia, and now we will start off with the various types of pneumonia, in which we will see their definition, their pathophysiology, and what is the treatment for the particular pneumonia. So for this I have already written on the board. In this particular video will be about the pneumococcal pneumonia, and the subsequent videos we will see the staphylococci pneumonia, hemophilus, and the streptococci, and then we will see the gram negative and the primary atypical pneumonia. So here we will focus on the pneumococcal pneumonia. Okay, this is very important, and you will see the questions from the pneumococcal pneumonia. So let us just see the pneumococcal pneumonia. Our next video after completing the pneumonia will be about asthma, so stay tuned with this nursing tricks in order to get the notes, and also in order to learn the things from these notes are made from the various, by referring the various books of the pediatrics. So let us see the pneumococcal pneumonia. So this, whenever we are studying about any disorder or any word, we should first see on to the what words are coming in that particular sentence. So here we can see the pneumococcal. So the pneumococcal pneumonia, it means this particular pneumonia is caused by the bacteria which is the pneumococci. This is the pneumococci. Okay, so the causative organism is the pneumococci. Now if I have to write the definition of the pneumonia, I will again write in my definition that it is the consolidation of the lung parenchyma, consolidation of alveoli or the lung parenchyma, or there is the infiltration in the interstitial cells. So this is the definition, and then I will write that pneumococcal pneumonia, it is caused by the streptococci pneumoniae. So if I have to write the causative organism, so the word itself is giving me a hint that it is caused by the streptococci pneumoniae. Streptococci pneumoniae. Okay, so this is the causative organism. So we know, or we that this is an infection. So respiratory infection which is caused by this particular organism, it is known as the pneumococcal pneumonia. Now very important, that how is it transmitted? So this is transmitted through the droplets. So the transmission is through the droplets from the infectious person to the healthy person. And this particular disease you can see in the winters. So in the winters it is most commonly seen. Now if I have to ask you a question, then I would like to ask that what are the risk factors even in the winters which can precipitate this particular disease? So the risk factors in this will be same as what we have studied in the introductory class. So it is the immunocompromisation, along with the malnutrition and overcrowding are the risk factors which can lead to this particular pneumonia. Okay, so we have seen the definition, we have seen the causative organism, we have seen the transmission, we have seen it is most common in, and we have seen the risk factors of this particular disease. Now very common, if we have to see the pathophysiology, if we have to see the pathophysiology, so I will just write the pathophysiology behind this particular disease. So the pathophysiology behind this particular disease is what happens once the bacteria it enters. Now this is the entry of the bacteria into the human body. What will happen? This bacteria will go in these are the lungs. If I have to draw the lungs, this will go in the lungs, and this will multiply. Where they will multiply? They will multiply in the alveoli. So once they enter the human body, they attacks the lungs, and in the lungs they attacks the alveoli and they multiply itself. Now once they multiply, what will happen? Our body will not keep quiet. What will our body do? Our body, in response to this multiplication, because they are not the part of your body, they are host to your body, what will happen? The inflammatory process will be initiated. The inflammatory process will be initiated. The inflammatory process, once it will be initiated, what will happen? Your body immunity will fight against the bacteria, and in this fight there will be exudate which is formed. The exudate is formed in this process, and this exudate is known as the inflammatory exudate. Now what will happen once this exudate is formed? It will lead to the consolidation, and you can see the scattered areas of the consolidation. There will be the scattered areas of the consolidation. Now this consolidation will be seen as a coalesce, C-O-A-L-E-S-C-E. This you can see in your questions. The coalesce formation is seen in the pneumonia. Now what is this coalesce? When the things they come together to form one particular mass, this is known as the coalesce, and it will be formed around the bronchi, and later they will become the lobular, or the lobar in the distribution, but there is no tissue necrosis. Is there. So this is how the consolidation or the coalesce is formed in the pneumonia, that is the mass around the bronchi. Now you can imagine, once the bronchi they are full of consolidations, they are full of coalesce, what will happen? The surface area where the exchange of gases are taking place will be less now, and because of this the child will have the dyspnea, the child will have difficulty in breathing, that is dyspnea only, and the child will also have the grunting respiration, the respiratory rate, in order to just have the more of the oxygen, the respiratory rate will be high, and because of this we have seen that the child have all these clinical features, just because the child is having the less surface area for exchange of gases because of the colles formation. I hope this pathophysiology is clear to you. Just for the revision, let us see what happens once the pneumococci or streptococci enters the lungs. It attacks the alveoli, they multiply in the alveoli, the inflammatory process takes place, and then the exudate is formed. This exudate is formed, it's known as the inflammatory exudate, which is formed in the process of the fight between your immunity and this bacteria, and then the consolidation takes place. The consolidation is when the things they come together in order to form something solid, which is the word, and then the colles is formed, and this colles is formed around the bronchi, but there is no tissue necrosis in the cells. Okay, now next, very important, there are some stages in which these things happens, means how this process happens. So this we have divided, or we can see in the 4 stages. The 4 stage, this is the common pathophysiology. Now let us see in particular what happens in the pathological process. So we can say the 4 stages of the pathological, 4 stages of the pathological process. So this 4 stages of the pathological process, students, this is very important topic, very important topic, and please you can mark a star in front of it in order to remember that what are the pathological process, and what is the sequence of the pathological process, and what happens in this process. So first of all, there is a congestion, and then there is a red hepatization, congestion, red hepatization, then there is a gray hepatization, then there is a resolution. We will learn in such a way that we don't have to mug up all these things. We can understand if we will understand the concept behind them, we don't have to mug up all these things. Okay, so first is the congestion, red hepatization, gray hepatization, and the resolution. Okay, so first is the congestion. So what itself is telling you that the congestion means something very tight is happening inside your lungs. So first very important thing that we have to remember is it is happening within first 24 hours of attack of bacteria. Okay, or you can say within first 24 hours of contracting the pneumonia. Now what happens in the congestion? There will be vascular engorgement. The vascular engorgement will lead to the intra-alveolar fluid, and you can see it happens because of the multiple bacteria. Now if there is a vascular engorgement, what will happen? The lungs will be heavy. So in this we can say the lungs are very heavy, and also the lungs will be heavy and they are red, heavy lungs and red lungs because of the vascular engorgement. Capillaries in the alveolar walls, they are very much congested, and the infection in the lungs, what will happen? It will spread to the hilum and it will spread to the pleura. And in this particular stage, what will the symptoms that we can see? The symptoms is the first one is the coughing and the deep breathing in order to compensate the oxygen of the body. Okay, so what will happen in the congestion state? The bacteria will attack the body, and it will happen in the first 24 hours of the attack, and the lungs will be very heavy, congested lungs, red lungs, and the symptoms you will see, they will be cough and they will be deep breathing. I hope the congestion is clear to you. Now next is the red hepatization stage. Now you can see here the red hepatization state. Red, okay, we know red is a color. Hepatization, hepatic means liver. Now why this word is coming here? So something is happening like liver. What happens here is this stage occurs, first of all this stage occurs at 2 to 3 days. 2 to 3 days after what? Congestion. 2 to 3 days after congestion, and in this lungs become the red, firm and airless. So these are the resemblance of liver. Okay, so alveolar capillaries, they are engorged with blood, and in this stage alveoli contain lots of erythrocytes, neutrophils and desquamated cells and the fibrin. So if in question they are asking you that in which particular pathological process the erythrocytes are seen, the neutrophils are seen in the alveoli, and so here the answer will go to the red hepatization state. Clear till here? Next is the gray hepatization. Now what is happening like gray hepatization? So this stage occurs 2 to 3 days after 2 to 3 days after the red hepatization. Okay, and this is a avascular stage. Avascular stage in which there is less vascularity, because of which the lungs appear gray. Lungs appear gray, brown or even yellow because of the disintegration of the red cells, and they are very pale and dry, and the fibrin is still present in the lungs. So in this is a avascular stage, disintegration of red cells are taking place, and the pale and dry lungs are there in this particular stage, pale and dry lungs. Last stage is the resolution stage. What is happening in this resolution stage? In this resolution stage, it is a progressive enzymatic digestion stage. It is a progressive enzymatic digestion stage. What is happened? The resolution or complete recovery, it occurs only when the exudate experiences the progressive enzymatic digestion. Once all these exudates which are formed in these stages is completely resolved, then it's a resolution phase, and this produces the debris. The debris is formed, and which is eventually reabsorbed, ingested by the macrophages. So this debris is ingested by the macrophages and coughed up or reorganized by your fibroblasts. So this was all about the pathological process of the pneumococcal pneumonia. Again, because it is an important topic, let us just revise what we have seen. The 4 stages are the congestion, red hepatization, gray hepatization and the resolution. In congestion, it occurs within first 24 hours of the attack or the congestion or the contracting of pneumonia. In this, the lungs are very heavy and they are red in color, and also the capillaries, the walls are very congested, and in this stage the child will have the coughing and the deep breathing. Second stage is the red hepatization stage, which occurs after 2 to 3 days of the congestion. In this particular stage, the lungs appear red, firm, airless, and this red, firm, airless, they resemble the liver. And the next third stage is the gray hepatization stage, in which you can say this occurs after 2 to 3 days after the red hepatization. This is the avascular stage, in which the lungs appear the pale and dry lungs, And last stage is the resolution stage, in which there is a progressive enzymatic digestion of the debris by the macrophages, and also which can be coughed up or the reorganized by the fibroblasts. I hope till here it is clear to you. It is very important. Congestion, red hepatization, grey hepatization. In also you have to remember the sequence of these processes. First is congestion, red, grey and resolution. Now next is we will see the clinical features of the this particular disease. Okay, so let us just see the clinical features. So the clinical features. Before starting off the clinical features, first question arises that what is the incubation period of this particular disease. So incubation period. The incubation period of this particular disease is 1 to 3 days. So 1 to 3 days is the incubation period. Just remember 1 to 3 days. And the general signs, don't mug up. Let us just see. There is a congestion, there is a consolidation. What will happen? Because there is an infection, there will be fever, which will be high. Okay, which will be quite high. Then if we will see the respiratory signs, what will happen? We have just seen that the child will cough, and that cough can be productive, can be non-productive in nature. And if it is productive, it will be the whitish sputum. The child can have the tachypnea, child will have the rhonchi, child will have dullness, child will have chest pain, which we have seen is a referred pain. Then child will have retraction, child will have nasal flaring, child will have pallor, or also it can go into the cyanosis also, because there is no space for the exchange of gases. These are the respiratory signs. Now if we will see the GI signs, first we have seen there will be abdominal pain, anorexia, vomiting, diarrhea can also be there. And abdominal pain, again we have seen is a referred pain. Again and again I am focusing on this abdominal pain because this is a referred pain which can be caused because of the pneumonia, and this is a pleuritic pain which goes there. Then what will you see in the chest x-ray? In the chest x-ray you will see the diffuse or patchy infiltration. The infiltration you will see. Now also if you will see the behavior of the child, it will be irritable behavior, restless behavior and the lethargic behavior. Irritable, restless and lethargic behavior of the child, that can point to this particular condition. So we have seen the child will have fever and that will be quite high. The child will have the respiratory sign, in which there can be cough, which can be productive, which can be non-productive. If it is a productive cough, it will be whitish cough. Okay, then tachypnea, rhonchi, then dyspnea, then there is a chest pain, retractions can be there, nasal flaring, and all these things are the general signs for the pneumonia. Okay, now let us just see one important topic to put in a box. Is we have seen that in introductory class also you can see I have mentioned that apical pneumonia, it can be because the meningismus or even the convulsions. The child can present with the meningismus and the convulsions, and this happens in case of apical pneumonia, and which is caused by the pneumocystic zerovacci. And this particular if you will go for the CSF examination, the CSF will be clear in this particular case. Now let us see the diagnosis. Now diagnosis, we can go with the history, we can go with the physical examination, and then also the X-ray findings, in which we have seen the lobar consolidation and also the leukocytosis, which is increase in the WBC cells can be there. Okay, so in the diagnosis, this way we can diagnose it. Now very important is what is the treatment to this particular disease. So let us just see the treatment. So in the treatment we can see first is injection penicillin V 250 milligram orally every 8 to 12 hours, or injection penicillin G 0.5 measuring unit kg per day IV, or injection procaine penicillin 0.6 mu IM, which is given IM daily. These three for the 7 days. Also injection amoxicillin 30 to 40 milligram per kg per day. It can be with or without clavulanic acid, which is an alternative. Clavulanic acid can be given as a treatment for this particular disease. So I repeat, injection penicillin V 250 milligram orally every 8 to 12 hours, injection penicillin G 0.5, injection procaine penicillin 0.6. For the 7 days it is given, amoxicillin say 30 to 40 milligram per kg per day. Either of these three are given, and injection amoxicillin, this is given with or without the clavulanic acid. And also very important is the oxygen administration. Now oxygen administration, it is very important in cases of the respiratory distress. Now we know that what are the signs of the respiratory distress? The grunting, retraction, nasal flaring, they are the signs of the respiratory distress. So these are the respiratory distress. If the signs of respiratory distress is present, we have to administer the oxygen as well, and we have to give the paracetamol for the fever. We have to give the paracetamol for the fever. So this was all about the pneumococcal pneumonia. We will be dealing with these different types of pneumonia in the different videos, so that we can just learn slowly, but we have to learn it very wisely. Why? Because the questions, when they will come in front of you, you will get confused that whether it is a pneumococcal, it is a staphylococcal, it is a hemophilus, or what type of pneumonia it is. Okay, so in this we have seen, just to revise, that what all things we have seen. We have seen the definition, we have seen the pathophysiology, we have seen the 4 pathological process that is occurring, we have seen the clinical features, we have seen the diagnosis, we have seen the treatment. Just to revise, in definition, the same word consolidation should be there. In pathophysiology, 4 pathological process we have seen: congestion, we have seen red hepatization, we have seen gray hepatization, and we have seen the resolution. Then the clinical features: in incubation period 1 to 3 days. Then we have seen diagnosis, we have seen the treatment, in which we have seen the penicillin, amoxicillin, oxygen administration, and the paracetamol. So this was all about the pneumococcal pneumonia. In the next video we will see the staphylococcal pneumonia, and in the subsequent the other types. So please just go and read this particular type of pneumonia from the book as well, and add as much as you can into your notes. Okay, so if you have any doubts, you can leave your questions in the comment box. Thank you so much for watching this video, and if you have not subscribed my channel, please do subscribe my channel and hit the bell icon to get the notification from my channel. And if you have any suggestions to improve, you can also mark that in the chat box.